The work that I'm presenting here at the ASCO GU conference, which actually won me the ASCO GU Merit Award, is my project on sarcomatoid bladder cancer. So sarcomatoid bladder cancer is a very rare, it's extremely rare because its prevalence is only 0.2 to 0.3%, and it's a very aggressive variant of urothelial bladder cancer. And as the disease is actually very rare, we do not have any consensus regarding the management of this disease, because most of the patients, they will succumb to death before even we can do something. And as we do not have any management consensus, what we do usually is we actually try to extrapolate what we have from urothelial cancer to sarcomatoid bladder variant. So that's what happens usually. And most of the time, the main management that we are practicing right now is radical cystectomy, followed by adjuvant chemotherapy based on the risk stratification of the disease. But that may not work in all cases because it's mainly for urothelial bladder, and other histologies like sarcomatoid or like small cell variant or neuroendocrine variant of the urothelial cancer, they all behave very differently and very aggressively. So we need to have a good treatment consensus for the management of these very rare diseases. And that's when I decided to look into the treatment options for sarcomatoid bladder cancer. And as we discussed earlier, as the prevalence is very low, it's very hard to do a single institutional study or even a multi-institutional study. And that's why I decided to look into a national cancer database, which captures almost 70% of the newly diagnosed invasive cancer in the United States. So from that database, I was able to find the patients with predominantly sarcomatoid variant, and then we divided the cohort into two cohorts, in the population into two cohorts. One was the cohort which received the neoadjuvant chemotherapy, and the other cohort did not receive the neoadjuvant chemotherapy. Because the main aim of our project was we wanted to study the impact of neoadjuvant chemotherapy in sarcomatoid variant, because it has not been studied. It has not been studied very well. And we got a sample size of 570 patients, which is actually a big sample size for this rare variant. And we found out that in the cohort which actually received the neoadjuvant chemotherapy, that cohort, they had more pathological downstaging when compared to the other cohort which did not receive the neoadjuvant chemotherapy. And when we looked at the survival statistics as well, the group which received the neoadjuvant chemotherapy, their survival was actually significantly higher when compared to the group which did not receive the neoadjuvant chemotherapy. And the group which did not receive neoadjuvant chemotherapy, the survival was like 20 months. And the group which received it, it was double, it was 40 months, and which was very significant. And the group which received the neoadjuvant chemotherapy, they were younger patients. So we adjusted it for the analysis for like all the confounding factors like age of the patient and the gender of the population, or the socioeconomic status and the receipt of chemotherapy and everything. And even after that, all the survival statistics were same and significant. So from our study, the main conclusion that we found that neoadjuvant chemotherapy is actually underutilized in very rare variant of urothelial bladder cancer. And therefore, we need to note that both the pathological downstaging and the neoadjuvant chemotherapy, those are actually independent predictors of survival that we could find from our study. So the main take-home point from my study is actually this study would be important in clinical practice, especially in a place where we do not have any consensus for the treatment management. So we should definitely consider neoadjuvant chemotherapy for the rare variant of bladder cancer, and especially for the sarcomatoid bladder. And my study has some limitations because it's a retrospective data study. So we need like more studies to validate these findings, and also to see like what other treatment options that we can offer to these patients. And of course, we need like more clinical trials incorporating all this rare variant patients, but that would be challenging given the very limited sample size that we can obtain, and there will be like challenges involving more patients, like patient accrual in terms of this rare disease.